Glad to have you here, Dr. Khalid. How are you today?
Thank you very much. Glad to be here. I'm good. It's my day off today, so it's paperwork day and speaking to yourself, which is a good break from paperwork. So thanks for having me.
Awesome. Glad you could take the time out of that day to come talk with me. I'm excited to hear from you because I am someone who loves humor and I love good humor. And I've watched a lot of the social media and all the TikToks that you make about medical humor, and I love it. Like you're genuinely like funny in all the videos, and
Thank you.
You have a YouTube channel too, which is like you put a spin on that where you use it to also educate, and so it makes the content very interesting and that. So I just really appreciate that. Just kind of start out though, what kind of motivated you to go into medicine as a field, and when did you know that was what you wanted to do?
So I guess my route was not really traditional in the sense that I didn't just get in the first time. My parents weren't doctors. I kind of, from a young age, kind of went towards science. It kind of made sense. Science and mathematics were my kind of thing. And then as I kind of just grew up, the path kind of just opened up a little bit. You kind of looked at what kind of things you wanted to do. I've always wanted to do things that impact other people's life. As cliche as that sounds, this almost sounds like I'm in a medical school interview. So it kind of just opened up and I thought, you know what, I'll apply. And I was kind of like, yeah, it'll be great if I get in. If not, we'll try something else. And I didn't get in the first time. And that's, I guess, that's when I first thought, right, I really need to have a look at it, because if I want to go down that route, I've got to be sure I want to do it. So at the age of, 17, 18, where you're kind of making these big life-changing decisions, having a failure as such makes you reconsider it and say, right, do I really want it that much for me to then put a year on, hold and retry and go and do all these things again? So for me, it was, doing a bit of work around medicine. So I took a job as a healthcare assistant. So they're basically people in the hospital that help nurses look after patients. So helping them with, their breakfast, helping them change, those kind of things. And once I did that, I was like, you know what? I did about 3-4 months of that. And I thought, right, cool. Next, season of exams, going to do better. This is what I want to do. And kind of being in the hospital, seeing the hospital's like a metropolis. It's got its own life beat and see ward rounds going on, lots of things happening. It was quite exciting. So that was kind of my initial route into it, and I did my exams again and got the grades and started medical school.
Gotcha. And I think this is funny because what I've heard from people giving me advice about like medical school interviews is whatever you do, don't tell them that you want to help people, because it's the most cliche answer. But it's interesting that that's actually like the base reason that a lot of people want to do it, and it really is because people want to help people.
Absolutely. It's like it becomes so much of like a little game of cat and mouse. It's like, okay, so it's this thing. They know I'm here for this because but I'm not allowed to say it. So I have to make some like long ass route around it just to kind of make up for it. But I found a way of kind of just going through my background, trying to break down why I wanted it so bad. And I guess that takes another level of thinking as well. So
right.
For me, it was kind of like my background of coming from Afghanistan, coming to this country at the age of 7, and seeing what terrible, bad healthcare is like over there, people dying, to seeing a country where they've got great healthcare, and being able to train and have that opportunity is I think incredible honor. So it was those kind of things. I just had to verbalize it. Sometimes that's
right.
The toughest part.
Right. And talking about the healthcare system there, I know it's drastically different than that in the US, where, we have insurance companies always, in the middle of everything. But what exactly is the NHS, and how does that system work? Like after you get out of medical school, do you go straight into it, or how does that whole system work?
Yeah, so it's a good question, actually. The NHS is basically like a socialist healthcare system. It's free at the point of contact. So anybody in the UK, if they get ill, if they're a resident here, can get services from the NHS, emergency services, operations, of those kind of things for free. There's no charge. And the way it is funded is through taxes. So the government pays to support every hospital, every clinic, GP surgery, and the way they do that is through taxes. And the way that gets cascaded down is basically you have the government paying the money to the kind of NHS England, which is a body that looks after all of the different areas of health services, say in the Southwest, London, various areas. And then you've got another group called the CCG, who then have to decide how much do we give to this hospital of the budget, how much do we give to this clinic, and all those kind of decisions, which are tough, that don't want to be making those decisions, are made based on the healthcare needs of the population. What are the rates of diabetes in this area? What's the socioeconomic look of this sort of area? How much more money do we need to put in to help people have access to healthcare in that area? So yeah, complex, but also from the outside very simple, in the sense that if you are ill, you go to a hospital. You don't need paperwork. You just go in and you get seen for the condition you have, which obviously very different from America. So for me, that's very sort of alien. I'd kind of the complexity, I guess, as well. I'd love to know more about that. It's interesting.
Right. Yeah, because the thing here, I think, like a lot of times people don't want to go to the hospital because of the high fees, and so most people like to deal with things, and they'll just like deal with it for a long time. And some of the times it's not serious, so that's okay. But then when it is serious, that's when it really shows its teeth, and is really bad. In terms of like, I guess downsides, I remember like learning about, like, I think Canada also has like a kind of similar system, and I've heard that like sometimes it takes a long time to schedule appointments because of because of the system. Do you have any kind of downsides like that, particularly of this kind of system?
Yeah, so you're quite right. The downsides are getting appointments and getting referrals. So for the moment, what we are doing with appointments with the COVID situation is we're doing, at the very point of contact. Say if I work as a family doctor. So for me to be able to see patients, we do a clinic, but we do one doctor a day doing that clinic. What we're trying to do is triage the majority via telephone calls and video calls, like we're doing today. So you can get a lot of information through that. But I guess the step where it's most kind of the biggest bottleneck is once you see a family doctor and they decide you need to go to hospital for X, Y, Z, and it's not an emergency, i.e. it's a routine referral for, gallstones that aren't giving you pain or anything like that, then that wait, the waiting times have increased, and obviously COVID hasn't helped with that. But yes, if you look at the waiting times over the years, that has increased, and that is a problem.
Gotcha. And about yourself in general. So you are a general practitioner, right? A GP, as they call it. What exactly does that entail? Is that kind of like equivalent to like a family medicine physician here, kind of?
Yeah, exactly. So there are different forms of GPs. You could be a GP who is a partner at a surgery. So you own and you run that surgery. There's a GP that's a salaried GP at a surgery. So that partner who owns the surgery then hires somebody for a set salary to work there, say 3 or 4 days a week. I'm what's known as a locum GP, which is essentially a freelance GP. So I'm able to set up my timetable, have time for things like this, and TikTok videos. But it gives me that little bit of kind of flexibility, because I'd be able to, just pick my shifts for the next month and find out, find gaps where it can be put in. So yeah, that's how it is. And yeah, essentially the same as for you guys. It's a family doctor working in a clinic, seeing patients in primary care. So we I think have 80% of the contact with people coming into healthcare. So we are essentially the gatekeepers who needs to go into hospital, who is there with a cold, who needs antibiotics, those kind of things.
Gotcha. And it's interesting to see, like, you guys are like you said, the gatekeepers, right? You see everything, and so you need to know everything, or at least like in a general sense, so you can direct people to different places. In terms of like, I guess education wise, after you finish medical school, what would be like the route to go through GP, or if you wanted to do like surgery, what steps would you have to take to do that? What exactly is the difference after medical school?
Yeah, so that's a good question. In the UK, once you finish medical school, so that's 5 or 6 years, depending which medical school you go to. So we don't have pre-med like you guys have.
Yeah.
You literally just go straight into med school. You may do sort of other degrees beforehand, but once you've finished, you've got your 2 years initially, which are your foundation years. So it's 2 years of being a junior doctor, as we call it. I think after the first year, you're able to pretty much do all, prescribing medications and everything like that. So you're fully registered after the first year. So once you've done your first 2 years, that's when you decide which specialty do I want to go towards. And if you choose medicine, say if you want to be an internal medic in the hospital, you go into core training for that. If you want to do surgery, you go into surgical training, and it's got its own interviews and its own sort of exams to go through. For GPs, it's GP training, and that's 3 years. So the first 2 years is within the hospital majority. I think I did a 4-month stint in the first 2 years within general practice, but essentially the idea is that they want you to get as much of kind of hospital-based experience. And it's, as you said, it's kind of general. So you're doing a couple of months in dermatology, a couple of months in rheumatology, a little bit of surgery. So you kind of just get a broad perspective of different specialties. And then your final, 18 months or a year, you'll be spending in kind of general practice in a clinic.
Gotcha. And in terms of you being a GP, what, I guess, gravitated you towards doing that? I know you, especially being a GP, you need to be like very open to people and very good at like socializing and communicating with them, because I think trust is so important, because you're literally have to listen and figure out, anything could be wrong. Like, you could have like mental health issues in the background behind, just a general appointment. So what exactly was it about the practice that drew you in towards that field?
I think it was probably a combination of a couple of factors. I think the first part was just the amount of variety there is. I would get very bored. I'm one of those people that would get very bored if I was doing just one task again and again. I'd literally be like brain dead. But the variety of that, that one day you're seeing somebody with mental health issues, something else you're seeing is sports medicine issues, you're seeing joints. It's kind of that kind of being a jack of all trades kind of thing. That kind of drew me to general practice. But also I think one of the things I kind of identified about myself through med school was what kind of things am I good at? And I think that's another important part to think about for medical students listening, is sometimes it's really good to see what are my key skills, the things that I feel I'm better at. And for me, I think communication skills was really up there. And so I did much better in my OSCE exams than my actual, written finals or your MCQ finals. So
and those OSCE exams are like the skills exams.
Yeah, sorry. So you guys probably call it something else, but yeah, clinical skills exams where you're doing, cardiovascular examination, you're doing respiratory examination, you're talking to patients. Well, they're actors, but they're pretending to be patients. So yeah, when I was doing those kind of clinical exams, I would do far better. And I thought, right, what kind of specialty would give me most contact with patients, and what kind of specialty can I take my skill set to, my communication skills to, and also general practice kind of provided that.
That's awesome. Kind of a jack of all trades.
Yeah, exactly.
That's awesome.
Master of none, jack of all trades.
Yeah, I mean that's kind of a life. Like some people say, like, you need to get like a well-defined arrow in some kind of particular field, but I just feel like, experiencing a little bit of everything keeps it fresh, like keeps it interesting day to day. Like you said, it's kind of numbing to do the same thing every day, but being able to experience all these things is. I mean, I guess it varies between person to person, but personally, I think I agree with you in that way. But kind of, I guess, transitioning from that, right? Your practice, and how long exactly have you been practicing as a GP?
So I finished medical school in 2011. So, and I finished GP training in 2017. So yeah, 4 years, 4 years coming up to being a general practitioner and being a doctor, almost 10 years.
Gotcha. And from the time you started, I know, like, a big thing that's happened is social media and the emergence of doctors and healthcare professionals on social media, which is amazing, I think, because you, as a as a family medicine doctor, as a GP in particular, one of your main things is connecting with people and gaining that trust. And I think that we're moving towards like a future where medicine is kind of like more casual in a way, in a sense where like people are able to learn about it from all kinds of sources. You address your doctor as not as like some, high, someone high above you, and you're able to really feel comfortable with them and talk to them as if, they're a friend. And you've really like captured social media well, and YouTube well, and the education aspect on there. But I'm curious to know, like, what caused you to look into social media and kind of apply medicine onto social media as well?
Completely happened by accident. So there was no plan to this. I think it started about 5, 6 years ago. And I think, again, I looked at what I learned from, and I'm a very visual learner. So for me in medical school, when I was looking at like OSCE exams, clinical skills exams, when I was trying to learn examinations, rather than reading it from the book, for me, it was a lot easier to visualize it if I saw somebody doing it. So it meant I was on YouTube, I was doing how to do this examination, and I saw that there weren't that many videos. There weren't videos breaking it down. And I think from that kind of experience going, do you know what? There probably are other students doing the same thing. So when I became a junior doctor, when I had a little bit of time, I was able to kind of just get a team together and right guys, this weekend, we're going to smash it. We literally did all of our kind of clinical examination videos. I think there's like 27 of them on YouTube. They were all done on the same weekend. So they were all done. We literally like woke up at 8 o'clock, went down to one of the clinical skills centers in London, and just like blitzed out all of the examinations, and then took years of editing it. As you kind of know, with editing, it takes a lot longer to do it. But it was kind of putting something out there that I thought hadn't been done that often, and something I'd want to see myself. And then it kind of continued and developed from there. Same with kind of TikTok. It's picking up where people are going, I think wherever people go, there's always going to be the need for information, and it's kind of providing that information in an easy, digestible manner.
Right. And talking about the examinations that you mentioned at first, like those blew up. Like you've gotten a lot of hits on that. I'm sure like you've helped a lot of people with those.
Absolutely. And that's something when you're making those videos, you don't sometimes expect that, and you don't know that. It's only afterwards that you get messages to say, like, there are a number of medical schools in India who are like, right, that's our key resource for our medical students. Is that cool? And you're like, wow, that's freaking awesome. That's amazing. Yeah, sure, use it. And they're like, cool, we're going to use our OSCE examiners are going to, do their checklist based on this. Is that okay with you guys? It's like, cool, absolutely fantastic. So it is, yeah. You sometimes when you do these things, same with the podcast you're doing, you don't know one day who it's going to reach. And when we did it 4 or 5 years ago, I had no idea where it was going to go. So it's all about kind of making content and trying your best, and then just putting it out in there, and then somehow the universe picks it up and flies away.
Yeah, that's amazing. And wow, like seeing that on such a grand scale, like I guess that's the motivation to keep doing it, right? To keep making more content, because obviously like someone is picking it up and finding it very helpful.
Absolutely, yeah. And I think the basics of it come down to, why you're doing it, the aftermath, and what happens afterwards, the views and the growth, and that's all fantastic and amazing. But the key part is, we were doing it because we were like, right, we could add something to here. There aren't that many videos that break it down step by step. I would really love to see what I'm looking at for the hands for a cardiovascular examination. So when you look at the very basics, it's providing something that's not out there. And I think we did an app as well that had checklists for all the examinations. So all of those things hadn't been done at the time. So it's kind of like, right, let's do something that's gonna be different, that's gonna be unique for us.
Right. And going into your future videos, like the ones that you've made, like recently about the vaccine, and a lot of education videos that you've made, you always put like not only do you have a really nice set, I love the background that you have in the videos. It's very, very aesthetic. But you tie in like a really good sense of humor into the videos. Cause like the another thing is like when you make educational content, the hard part is getting people to stay retained throughout the content, to make it actually stick. And I think you've mastered that with how you make videos and tie in the humor part of it. What is your, I guess, the question is, what do you see as the value of humor in educational content and in, I guess, enlightening topics in general?
I guess it's just not to bore the hell out of my viewers. My humor is, this is what I'm like throughout, I was like throughout medical school, what I'm like throughout my house. My wife will just be shaking her head at some point at the rubbish jokes I'm making. But for me, it's kind of just adding that bit of personality, because I don't want to stand there with my white coat and tell you, these are the 5 signs. These are the 5 signs of anemia. You got to look out for this, and this. It might work for some people, but what I find is I don't learn from that. And I never learned from that as a kid or growing up. So for me, it's kind of putting in memes, things that I, on a day-to-day basis, my friends or my mates are sending to me, and are things that I find funny. And it's kind of infusing my personality into teaching something. And I find when you bring that into your line of work, your content creation, that's when I think you can engage a lot more with people. So yeah, there are no videos with me wearing a white coat and pointing at a whiteboard, I'm afraid.
Yeah, I'm completely okay with that. And how have you seen this like in your practice with your patients? And how do you think that, you mentioned like bringing out your personality when you're communicating over videos or through patients. How do you think it's affected your relationships with your patients?
I think it's really good. I have a very chill relationship with my patients. I don't use my surname, so I call myself Dr. Khalid. So for me, it's that kind of, I think you mentioned at the beginning, it's reframing that relationship and allowing them to be able to say things to me that maybe they wouldn't say to other doctors. And it allows me to have conversations like just the other week. I was speaking to a patient who had refused, the elderly patient in their late 70s, refused what we call a 2-week wait referral. The 2-week wait referral is when you are referring somebody who you think has cancer, essentially. So they should be seen within 2 weeks, investigated. And I kind of looked at the notes. I was just calling them for something else. They'd been dealt by another doctor, and doctor documented perfectly well, told the patient they need to go to hospital because we're worried about cancer. The patient said, I'm feeling fine. I'm good. I don't want to go to hospital. So I was calling them completely other reason, just to check up. I think it was a medications review. And I kind of just went, whoa, let me just have a look at this. Let's just revisit this one. So you kind of didn't want to go to hospital, but then we're worried about cancer. And he was like, yeah, but I feel fine. I'm actually okay. And I was like, okay, let's go into, I was like, what kind of work, what line of work did you go into? What kind of work have you done before? Trying to get a bit of a background of patients who I've never met before. It's like, well, I was an engineer. I did this, that, and that. I was like, so say you're an engineer, say you're on a bridge and you're driving along, and a structural engineer comes up to you and says, really worried about the structure of this bridge, and that there's a high chance, or there is a chance, this bridge could collapse if you're driving along it. From where you are in your car, that bridge may be perfectly normal, perfectly stable looking, but you may not know that. And I gave him a bit of chance to think about it. I didn't ask him to change his mind at that moment. I said, look, call us back, have a good think about it. But we, as the structural engineer, are worried about this bridge. We think there could be something wrong. And a couple of weeks later, he called back and went in to have the investigations, and they found a cecal cancer, and they were able to remove it, or they're in the process of removing it. So it's that ability to communicate, but also try and find out where somebody else is coming from, what their mind is thinking, how they're processing information, I think is really key.
That's absolutely insane. Like to hear that, like, I think that, because you're not only, you know, telling him, you know, what's wrong, but you're getting like a greater understanding as well. Like you're responsible to not only understand the condition and understand the diagnostics behind it, but then you have to tie it into the aspect of where are they from, where are they coming from. And I think that's really interesting, like how you're able to do that. Is that like, I'm assuming that's something you gain with experience, right? Being able to communicate with patients at a level where, you know, for a particular patient, these are the things that would work on them to convince them to do this particular thing, or these are the particular things to avoid when talking to a patient in order to stay on the good side. Like, have you had like experiences, I guess, in the beginning where I guess you might have brought something up that maybe like didn't help your case, you know, in convincing a patient?
Yeah, I mean, you learn. It is absolutely an experience thing. Like one of the things I now absolutely know not to say is when I'm doing a home visit, or you're going to see somebody in their home, if somebody opens the door and you think that that's the person's mum or their sister, you don't say it. Because once or twice it may have been that I've gone like, oh, is this your mum? And they're like, no, that's my partner. And then you're like, well, I've put my foot in it now, haven't I? So I think you quickly, through experience, kind of work out what things you should say. There's not, there wasn't like a manual, a study manual to tell you in medical school not to ask these questions, but quite quickly you learn to kind of tailor your questioning, and a lot more about letting the patient tell you. So my question now is like, and you are, or are you a family member? So I tend not to ask things as directly. But yeah, I think it's experience. I think with experience, you learn how to communicate more effectively with your patients, and knowing them it will make an impact, because once you build that relationship, you kind of know what their personalities are like, how they take information in, how they, their decision-making processes occur. So, yeah.
Right. And so those are the kind of things, I guess, like it's important to take a history on a patient, but also take down and document those things as well. So when you meet that patient again, you're able to bring those up, I guess. So,
yeah, cool. Absolutely. Sometimes I even write little bits of information in my notes where it's more so in the future, it jogs my memory that, this is the patient that has, a hobby regarding stamps or something, and then it'll kind of jog a few other things about that personality, that person's personality, what kind of, what's their decision making like, or things like that. So it may not be super important with what they present with, but it kind of helped me jogs my memory to remember them.
Gotcha. And in terms of, I guess, long term, right? In recently you've started all like online ventures through like TikTok and through YouTube, things like that. And as working as a GP, do you have any kind of, I guess, long-term goals that you're hoping to accomplish through, your practice and through, your online presence? And it's a tough question, right? Because like, you don't know where things are going to go. Like you never knew that you're going to make social media all of a sudden. Right. And do you have anything like kind of rough then?
I think not particularly. I think when I started making videos, it was because I enjoyed making videos. I was making short films in medical school, and that were rubbish, by the way. Short films in medical school, and kind of just submitting them to like film festivals and stuff. But it was more just the art of doing videoing, editing that I've just kept up, because for me, it's like a hobby. It's the thing that I enjoy doing on the side that means that I'm sane when I'm doing my medicine. So I think if it's medicine 100%, then you it's going to be tough unless you're one of those people that just kind of jumped out of the womb and you've just been like, I want to be a surgeon and that's all I want to do. So, just kick the surgeon away and just grab their scalpel. So if you're one of those, then you probably don't need much more. But for me, I always needed other things around medicine, outside of it to keep things interesting for me.
Right. And I can completely relate with you, I think, because medicine is what I want to do. And of course, I'm not in medical school yet, but recently, like getting into this podcast, getting into making YouTube videos, things like that, like it is a lot of fun. I think that's really interesting. And I'd love to hear about those short films that you made. I know you say they're rubbish, but I'm sure they're a lot of fun and I'd love to hear about them. But I enjoy doing those kind of things too. And I think that's really interesting in a way because you're able to take that passion and then merge it with your passion for medicine, make videos, and then help people even more on top of just helping people in your practice.
Absolutely. It's like the ultimate kind of thing. And I think that the part that it like blows my mind is that in a given day doing medicine as a family doctor, the maximum number of people I can see are 30 people. So we see 30 people in a day, 10-minute appointments. But if I make a video that talks about a health topic or the COVID vaccine, I'm able to then impact so many more people in that period of time. You can be impacting people whilst you're asleep. That's the crazy part, is like when you make content, the power of it is incredible. So that's the part that blows my mind. That's the part where I'm like, this is really, really cool.
Right. And I want to talk about one of those videos that you made. And we talked about this a little bit before, but you made a video on debunking COVID vaccine myths. And I loved it. I remember you talked about the microchips at one point and you're like, logically, why wouldn't they just use your phone? Like, obviously, like that makes a lot of sense. Yeah. But the thing that I was shocked about, like the first thing I saw was the dislike to like ratio. And I saw a lot of dislikes on there. Yeah. Like it was almost half and half.
Yeah,
and I was like, why? This is amazing. And then I scrolled down to the comments and it was a war zone.
It was like bodies everywhere, man. there were people that were there that absolutely crazy. So what's interesting, this is one of the parts where we could be going into a complete different topic altogether, is the algorithms for these social media companies. There is madness in there as well. So what I'm seeing with this video is I'm presenting information, and normally what you would think is, right, if it gets really terrible reviews from the people that have seen them, i.e. you get loads of dislikes, loads of kind of things that say, I believe in microchips actually, and I'm like, you mean oven microchips? Yeah, I enjoy those too. You would think the algorithm would just say, right, this is just a rubbish video, let's put it to one side. But what it's actually done is it's just pushed that out as one of the videos that's done really well, which is really frustrating. It's in some ways I look at that and think, so for a video to do well, it just needs to start a massive conversation, a massive war zone essentially. And the algorithm thinks that's fantastic. Let's just keep pushing that. So for me, yes, it was a good video in the sense that I was presenting information. I thought, right, nobody's done a proper debunking video. There's a lot of comments on TikTok that was like, what about the microchips? And I thought, right, I'll bring all of those comments that people make and I'll just go one by one. Why does it not, why doesn't it affect your DNA? Why doesn't it do this and that? But yeah, the comment section, because YouTube is a search engine essentially, and an algorithm that then tells people what to look at next. People are searching conspiracy theories, so they're getting that video coming up. In some ways, it's fantastic because at least you can present that and say, look, that this is the counter argument to you, but people don't always listen, I guess.
Right. So it looks like the video is being sent to people that are already iffy on vaccines and people that, might have part of them believe that, microchips and things like that.
Absolutely. I think the majority of people who watched that video, I looked at because I was wondering exactly the same thing as you, like, right, what is going on here? I looked at the search terms that were coming up for the video, and it was literally like COVID conspiracy theories, COVID vaccine bad, all the kind of things that you would be like, that's some sketchy people doing that thing. But it's in some ways really worrying as well, because there are people who deny that COVID exists still to this day, which blows my mind. It's absolutely incredible. So in some ways, I don't think you can completely change the mind of a denier, and that's something that even if you present fact and science, they're not going to change their mind. But what I'd hoped was that if there were people on the fence, if there were people who wanted information, because sometimes people have valid questions about vaccines, then I could present it and say, look, this is what we know, this is what we don't know. And that was kind of the aim.
Gotcha. And like, it's just very concerning, I think, seeing things like this. And when you, I guess, are working, do you encounter patients that I guess are hesitant about it? Like, have you had talks with your patients to see, like, I guess, the vaccine hesitancy that, is present within, patients that you have, and how do you go about dealing with that?
So luckily, I've not come across anyone that's been hesitant about the COVID vaccine. Yes, in the past, when I've been doing clinics, and mothers would come in and say, I'm not going to give, I'm thinking of not giving the vaccine for my kid. And then, yes, you have the conversation, you go through the logic of how they've come to that decision, and you try and talk them through and guide them to resources that can evidence base the good reasons for having the vaccine. But unfortunately, you can't always change people's mind with this, and sometimes it becomes a bit of a losing battle. But all you can do is just say, look, I appreciate that's what your thoughts are. This is the science. This is what my medical advice is as a doctor, looking after you and looking after your child. But I've got to say, I've not come across anyone so far in real life that has said no to the vaccine. So luckily,
right. And I think the concerning thing is, once we're able to get it, for the common people, like anyone, that wants it can get it. I think that's really when we're going to see a lot of these people in the comments in person. And it's
absolutely.
A scary thought.
Yeah, absolutely. And that's going to be my thought on it is, look, people want freedom. That's all cool. But if your freedom impacts poorly on other people in your community, i.e., for you to say, I have freedom, I'm not going to have this, it's all fine. But you're going to impact on your community because you could be spreading it. And that's where it starts to be a problem for me in my kind of logic of, should people be, should they have the vaccine? Should they not have the vaccine? So if you're in a society and you're going into shops, you could potentially be spreading it. And that's the difficulty, is that people just want freedom and they want to exercise it for whatever reason, just for the sake of it. And they share the communities, and there's very little thought about what the majority of other people want in that community.
Right. Because it's your freedom, but you're taking away other people's freedoms. Yeah. And that's the frustrating thing about the pandemic. And not to go on a tangent or anything, but this is like the thing that gets me the most about this thing is the people, that are social distancing, the people that are staying home. Like, my parents literally have not seen anyone in the last year, like very, very small interactions. My little brother, who's 6 years old, like, hasn't seen his friends. We're taking it very seriously. And then there's the people that aren't taking it seriously, and we're sitting here waiting because of these other people. And then another annoying thing is, like, I've been talking to a lot of, healthcare professionals like yourself, hearing these stories, hearing the stories that you've shared, hearing the stories that other doctors have shared of patients literally being wheeled in, gasping for breath, people that are on death's door. And then hearing people with I guess, the audacity of saying that this isn't a real thing. It just, I don't understand how mindless and how under a rock you need to be to believe that.
Yeah, absolutely. And that's the most frustrating thing, is when you come into contact with people who just deny what is actually happening in existence right now. Because you could believe one thing or another, you can believe whatever you want about the origins of COVID or whatever, But to deny that it's happening, where people are actually dying, and then have the audacity to call other people sheep, it's yeah. That's a mind.
As a healthcare professional, does it I feel like if I was practicing right now, I would be aggravated out of my mind every day to see this, especially you on social media, you're seeing it even more because I feel like people feel like free to comment whatever online because, they're hiding behind their screens. But seeing that even more, as being on social media, does it irk you to the point where you're just, I guess, so fed up with it?
I try not to. I'm somebody who, the thing is, I think if you let trolls affect you, then you're never going to be able to, be on social media, to have a platform to say things. And that's the important thing. Yes, there'll be a comment that annoys you a little bit, but at the end of it, what I look at it is, look, am I doing more good by what I've done, or is it, or second of all, what good is it going to do for me to respond to that troll? So if I've got something witty to say, I'll say it, and that's the end of it. I don't want to try and change their mind, because they're not going to change their mind. But if they want to talk about microchips, I'll probably make a comment about microwave chips and say, yeah, good on that. If they want to talk about the higher order, I'll talk about lizards. So I think you've got to see trolling as I think you've got to become a troll. The true art of dealing with trolls is you've got to go to the next level and become a troll yourself. No, I'm joking. So the way I see it is, yeah, you could, but for me, social media is people hiding, as you said, behind fake photos of whatever and saying what they want, and I try not to let that affect me.
Right, and that's the biggest thing, I think, focusing on the good that you're doing and the people that you are helping.
Exactly. That's the main thing.
That's awesome. Well, going back a little bit, and just a little bit of a more chill topic. What was one of those films that you made? I'm actually genuinely curious. One of your medical school.
I'll tell you what, the acting in it was terrible. Thankfully, I don't think I acted. I went, guys, I'm going to be the director because I'm trying to, this is the vision I've got. So I've got my friends to do it. And we still take the mick out of one of my friends for his acting in it. One of them was called Drug Runner. So that was about, so I kind of grew up in a quite rough London social housing kind of area, lots of kind of crime. And this was about a guy that was trying to get out of the game. When you're young, you're I'm going to make an edgy film, man. It's going to, Christopher Nolan's going to
change the world,
Tarantino's going to be like, do you know what? Come here. You be my second in command. So yeah, we were trying to do an edgy drug thriller. It was just a 5-minute film, but I think it's still on YouTube. It's called Drug Runner.
I'm going to find it.
At some point, I'm joking. So that was that. And then my brother did a really good one. I think my brother's, I've got a younger brother. He's 7 years younger than me, but he did a good one. I think it was called Human Within or something like that. It was about a zombie, a different take on the zombie kind of apocalypse when that was in. There was a time where zombies were cool.
Zombies were so popular.
They were so popular. It was what was it? Call of Duty zombie mode, when it was that was the thing. And now it's oversaturated, and every time you mention a zombie film, people are just oh,
again, yeah,
yeah, not again. So yeah,
cool. And I was talking to someone else about this, but the power of film is limitless, and that's kind of the thing that really gets me into it. If you can tell a good story, you can change so many people's lives.
Absolutely. For me, when I look back at medical school as what was the thing that kept me motivated through med school? Cinema. If I was doing poorly on an exam and I needed to pass the next exam, and I had a rubbish day of revising, spent 12 hours doing nothing, procrastinating. When it got to the evening, this is probably still procrastination, it probably was, but I'd convince myself, if I watch a really inspirational film, the next morning I would be ready. So my go-to films were Pursuit of Happiness. I don't know if you've seen that.
Yeah, I love that one.
It's
beautiful.
it's incredible. And I can't believe he didn't win an Oscar for that, Will Smith. So I think he was nominated, but he didn't win it. Pursuit of Happiness, Gattaca. I don't know if you've seen Gattaca.
I've heard of it. I think I might have seen part of it. I feel like it's a really popular film. I know, right?
It is, yeah, and it's so underrated as well. So it's not like, I don't think it did that well in the market when it came out, but it's such a good film. And yeah, a few others where I think the power it inspires is incredible with film, and that's one of the reasons I started to make short films, and then I started to make YouTube videos.
Right, and see, this is like the, I think, best intersection, right? I think sometimes with medicine, it can seem like monotone, can seem a little bit, what's it called? Like repetitive day to day.
Yep.
But videos do an amazing job if done well of capturing those emotions. And I think this is one of the things that I really was frustrated with mainstream media about during this pandemic is the lack of those stories from healthcare professionals and lack of like filming them in a light where you're empathizing with the doctors and really understanding the experiences that you are going through.
Yeah, absolutely. I think the power of being able to tell a story when it's done properly, when it's done well, is incredible. You've seen, I mean, YouTube, the way it's taken off with vlogs and things like that. And now we're seeing a lot of doctors doing their vlog series where they, spend 24 hours with me on call. They're so popular, these kind of things. And it's because people love to have an insight and a little window into somebody else's life to see what is that like. And I would have been exactly the same as like a 16, 17-year-old. I would be Googling the crap out of that kind of stuff. I'd be like, right, what is it like to be a doctor? Because you didn't have that. You kind of just had either a story of somebody who's a doctor who'd tell you what it's like, or you'd have, a family friend or, an uncle that's a doctor. But this is an actual window into somebody's life for 24 hours.
Right. And it inspires, continues to inspire people, like having these role models and people that, we want to be in the future, or someone to look towards as a goal.
Absolutely. Yeah, exactly.
That's awesome. Speaking of role models, did you have anyone, you're talking about how, you grew up in, or you moved at such a young age, and, I'm sure like it was difficult doing that. Did you have any, role models to, get through that? And then, you mentioned how you had to reapply to medical school and to stay committed towards that.
Yeah, not sure, to be honest. I think my biggest role model probably been my granddad. So he lives in Sweden, but in terms of just his life, it's just been like incredible, just by pure inspiration. So he was, one of the oldest of his family. His dad died when he was just about to go into university, so fairly young. So he had to support the rest of his family. So kind of somebody who's taken on the challenge and ended up going to do he became a police officer in Kabul, in Afghanistan, and he did like the police academy, became one of the best police officers from his class. And it's kind of that rise of somebody. It's almost like a movie, isn't it? And if you're interested, I think we'll be able to sell the rights to that.
Write it down.
So, but yeah, I think the just inspirational basis of somebody who's done incredible things, I think, would be my granddad. But I wouldn't say in medicine I've had anything to that effect. No kind of specific role models, but yeah.
Cool. And role models are universal, right? They could be doing some other kind of career, but at the same time, you could just admire to or hope to achieve that kind of success in something else.
Yeah, absolutely. Like recently, I saw the documentary on Netflix on Michael Jordan. I can't remember the name, but it's just like it follows the Bulls through the period of time that he was there, and he's another one that I know nothing about basketball, like literally zero, apart from like you have to just dribble it and put it in that hoop and it's cool people cheer. But to see somebody, and sports I think is another major one for kind of being, as a role model. It's incredible what people can achieve. And sometimes people would say, well, why are they getting paid so much? They're just dribbling a ball and shooting at a net. But they become incredible athletes. And a lot of it, I think, is about their mentality and what it is to be a great athlete. And I think that inspires as well.
Right. That's awesome. Well, thank you, Dr. Khalid. I don't want to hold you too long, but this is an amazing conversation. I really enjoyed talking to you today.
Thank you so much. Thank you for having me. It's been awesome.
Yep. Do you have anything else you wanted to add?
Not particularly. It's been a pleasure.
Yeah. Thank you so much.
Thank you.
I hope you enjoyed listening to our conversation, and thank you so much for listening. If you love Medspectives, be sure to follow us on Spotify, drop us a review on Apple Podcasts, and share this podcast with your friends. It really helps us grow, and I'd really appreciate it. Thank you so much, and I'll see you next Monday.